another episode of the Cafecito. I'm your host, Christiana. I'm so excited to bring yet another episode with an amazing everyday person doing an extraordinary thing. You all know by now, we recognize that in our community, there are extraordinary people like you and I doing amazing things. And it's important for us to highlight that because we want to ensure that our narrative is put out there by us, for us. Again, we want to thank We The Plug as a sponsor. We The Plug, if you have not checked us out yet, please go to our website, We The Plug, that's THA, not THE.com, because, you know, we got that flavor. All right. Well, today, it's Friday, and I got Mohamed. Hey. You know, you all missed out. We were rocking out to some good old music, and maybe we'll put the link. We should do that. We'll put the link for them because you all need this good music. Y'all need to feel this energy because that's what we need right now is positive energy to put out there. Mohamed, how are you?
I am well. It is Valentine coming up, so that music,
Come on.
dance to it, be in good spirit, love, single or not, you still
That's right.
mighty. It doesn't matter, celebrate you.
That's right. Whether you're single or not. You know what? Mohamed out here with a word, y'all. Whether you're single or you're not. The first love should be yourself because you can't love anyone else when you're struggling for your own self-love. It's going to be really difficult. Well, you can, but it's going to be difficult. Mohamed, you already taking this on another level. Come on now.
Just saying. And even if you are, we're giving extending good spirits with hugs, virtual hugs to you. So we're all good.
We are all good. So while you are introducing yourself, because that's what we're going to do right now, I'm going to change. I recognize my name in here is not set up right. And you guys know how I do. This is like laid back. And we definitely want you all to feel comfortable because, you know, the entrepreneur life is all about that quick pivot when that needs to happen. So now we are good to go. Mohamed, tell the people who
And
you
now
are.
that's her real name. Her name
That is my real
Luis.
name. It's Christiana. Before it said Luis Martinez. Maybe it's my alias or just my business partner, you know, and friend. Mohamed, tell the people who you are and what you do.
So my name is Mohamed Kamara. I go by Mo, short and easy. What I do is interesting. So I began my journey into the healthcare space because my sister passed during childbearing due to preeclampsia, which is a hypertensive disorder. This happened in Sierra Leone. Um, she was being rushed to the hospital and she got to the hospital, but by the time they attended to her, she was gone. I thought this was an issue that occurred in the third world country only. It doesn't affect the first world country, meaning the United States and other countries, but that wasn't true. That was a lie. That was a bad assumption. And so fast forward 4 years ago, my aunt died of the same condition, preeclampsia in Columbus, Ohio. Thankfully, her son survived. Her son is 4 years old now, and my dad and my mom, my stepmother, are caregivers for the son in Columbus, Ohio. So those two tragic events brought me to the healthcare space to really try to affect and make a positive change for Black mom and Latino mom and around maternal mortality rates. Our entire mission is to reduce our rates by half. So that's our mission, and we're trying to solve that through increasing access to care via telehealth and wellness for providers and patients. So that's what we do.
Wow. First of all, you know, you sharing such intimate experiences that you had early on in your child rearing years and having to process through that, the loss of your sister, and then as an adult experiencing that yet again with another family member. I mean, one of the things, first of all, I want to acknowledge that and thank you for being transparent and sharing that, because oftentimes what we don't talk about when we look at being a founder is the emotional trauma that sometimes we experience that pushes us, compels us to launch whatever that business is. It's not always us being driven by something that is lighthearted. Sometimes it's something that is very painful.
Mhm.
So I thank you for sharing that. So as you were, I mean, obviously you're a child and you're hearing these stories, and then you're coming of age in America because you transitioned from Sierra Leone into America, and you see the same issues are happening here in America. I mean, there's so many stories. I have personal stories that my family have experienced with healthcare, them working in the system and also needing care in the system. But when you saw that, I mean, I know for me, I hear all this, and so it's like, well, what do I do? Like, how do I be the change that is going, our spark that's going to really move the pendulum from that place of hurt and harming our people, our women, especially of color, to one that's healing, protecting us. How, like, what did that transition look like for you from experiencing this and then you coming to a place of, okay, I'm gonna create this company? Like, what did you have to do to get to that place?
So I considered InovCares as my therapy.
Oh.
So when you kind of create something, you're healing through that process, right? It's
Mhm.
still ongoing, and InovCares is that therapy for me, selfishly. But at the same time, it's also an open-ended conversation that we invite everyone, moms, so women that are of color and their family, to come together to solve it, and
Mhm.
that includes even the workers as well. So an institution to try to really do your best to remove the bias that exists in care delivery for Black mother. The first bias oftentimes, and as well as Latin mothers, but the first bias that happen in health disparities is the fact that for African American women, they tend to have high pain tolerance.
Hmm.
We change that narrative
Right.
because of back in the days, that narrative is still present. And so when patients go and get care, that narrative is still in huddle in terms of the getting the proper equitable care, one that is of dignity, respect, and compassionate, and knowledgeable at the same time. Getting that equitable care is the entire mission of Enough Cares. So part of that solution really involves not just from a tech point of view, which is with the space that we're in, but it also involves policy, right? And
Mm.
those policies are what needs to change in institutional racism. Health disparities is an institutional racism. But in terms of for us, the way that we try to address this issue is ensuring that people have access to competent, culturally sensitive clinician, one.
Mhm.
So, secondly, is to ensure that they have a wraparound service of a safe community where they can be able to go on walks, rides, go on bike rides, and ensure that they have that safe community that's cheering them on, and we give them rewards for adopting those healthy behaviors. So, really, it's an entire and a comprehensive look at the systematic racism that continues to go on, remove the bias, provide wraparound services, not only connecting to wellness and health coaches, and as well as doctors that are culturally competent, but then as well ensuring that there's a safe community for you to be vulnerable and be well at the same time, and be supported by data, right? To say, hey, how are you feeling? Be able to do a virtual assessment in your own home without even having to leave the hospital. And that's the part that technology is even patented by NASA, right? So that's the conversation that we're hoping, the narrative that we're changing. And we launched this platform in in three clinics in DC, in a behavioral health clinic, a women's health clinic, and a pediatric clinic. So we saw about 3,000 patients virtual visit that occurred there, and now we're scaling this into for potential partners that want to partner up with us, so employers and as well as health payers, right? So because then we can be able to reach more people and be able to serve more people that way.
So, as you're sharing right now, I hear you saying it starts with education, linked to policy, and then that will translate into advocacy work to push the narrative forward that we need to do more work in not just in the healthcare system itself and in the community, but also at the government level in order to make this really work. So I guess my next thought is, I mean, immediately my next thought is, okay, well, obviously this is something that we've been doing for a while, right? It's kind of like a hamster on a wheel that has been going on for a while. We know that we've had large disparities with um, not just underrepresented communities from the Black and Brown community, but also socioeconomic as well. Lack of health care, insurance, all of that. When you do go in, you get poor service. But then there's that other part of mistrusting the system, right? So even when there was this push to educate and bring in more physicians and work to change the policy, there still was and is this narrative that's continuously taught in the healthcare system of not just even exploratory how should I say this? Exploratory procedures on that happens with Black and Brown communities that we know are very harmful. It happened to one of my aunts um, and resulted in her losing part of her organs, and nothing was wrong with her, nothing. And she was at a hospital that was a research hospital. But so, I mean, it's kind of like we know these systems have been around for a while. We know we've been challenged with trying to get to the answers. What is different about the approach that you're taking to 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 change this narrative?
Yeah.
I know it's not just you. There are other groups out there doing the same thing. But what's different now? Talk to me about like what's going to be the impact needed in order for us to see a more holistic approach to this and the numbers go down with birth rates, or excuse me, birth rates go up and mortality rates go down for
Yeah.
adult loss.
Correct. So what we're doing is it's not just on a policy point of view. For us, we're looking at the whole woman to be able to identify the causes to preeclampsia very early on. So to be able to identify hypertension as a cause, stress is a cause, those lack of well-being resources are a cause. Then connecting the individual, the patient, the woman, to the resources that they need immediately, i.e., culturally competent. Again, I mentioned culturally competent because that's a gap. Culturally competent means that the person else that's a caregiver over the other screen that's seeing you already understands the challenges. And so there's a already a soft landing,
Mm.
if I may, because when you go then to a care that is not culturally competent,
Mm.
there's never a soft landing. And
Yeah.
oftentimes there's all what we know in here in the healthcare space, denying delay. Delaying delay can cost you your life. It cost my sister's life, definitely cost my aunt's life.
Yeah.
So part of our solution is part of that, and also identifying the social determinants of health. It's a big lingo. It just means that there are other issues that affect the person's health beyond just healthcare delivery. Social services such as healthy foods. Is there healthy foods in the neighborhood? is there also then transportation gap when the mom is ready to go get care, right? When the woman is ready to go get safe care, can they do a virtual consult? If not, can they also have the right transportation that's non-emergency, of course, or the right ride to take them to that appointment without having to feel as though they have to cancel the daycare, right? That's the challenge women will experience, that they have to get a daycare for the son for their loved ones that they're taking care of, and then they have to worry about all those sort of issues as well. So we're thinking of the whole woman when we've created a solution. It's not just a piecemeal approach, which is the issue with healthcare. Piecemealing healthcare means that you're going to be telling that person that's already stressed and trying to bring to life not a human being, go to this all these different specialists, right? And they're burnt out by the time they even goes from their primary care physician, a PCP, to their OB, to their maybe they may be suffering and having back pains as a result of carrying the baby for those several months, right? PT, and you're telling them to run around. They're tired, they're fatigued. Current platforms also tell you this too, that log into all the different channels so you can get care. So that means log into get care for medication management, log into a different platform, log into a virtual video text visit, different platforms. So that's a challenge in itself. If you're tired already, physically you're being sent to different places, and then you're already physically tired by remembering 10 platforms, 10 passwords. We don't
Right.
want that. That's disconnected care. So you're just making the issue worse. Let's connect the care for you so that you can go and live your best self and have a community from a that will cheering you on as you adapt those healthy behaviors. That's what makes us different.
Wow. That is actually plain and simple. And what really stuck out to me is something that I used to do back when I worked in nonprofit, is something called community mobilization. And the whole idea behind it was that you went into a community and partnered with them to identify risk factors and the protective factors that were going to help address those issues. And as you were sharing with me, that was the first thing that I was visualizing, is that it's a community effort. So it's not you or the health industry or policymakers saying, we're here to save the day. Dun, 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 dun. You are actually partnering with women, with mothers, and other leaders in the community to assess what the barriers are. And to your point, transportation is huge. And even some of these communities, when you were talking about nutrition, they're food deserts. And so, yeah, it made me really see clearly the difference between it, is that you're taking a more equitable approach to this by partnering with those that are directly impacted, to say, we want your voice to be heard. We want to make sure that we are reducing barriers, and especially how, yeah, that's just that that's truly the change. Because you had also mentioned something about systems. I remember, again, when I worked in the nonprofit space, that whole community working in prevention, education, and early intervention, one of the major issues that would stop, whether I was working with undocumented people or documented immigrants or low income, or it did not matter. The most frustrating barrier that would come up was how complicated systems were. And it almost seemed like it was intentionally, which I do believe at times it is, intentionally created to frustrate you to the point where you just give up. You acquiesce. You go, okay, I'm not even going to bother. Um, and and I love how you are sharing your intentional approach of wiping that out, of dismantling that, because again, the whole idea is to address the whole person, and you can't do that when you're not looking at the entire picture. of the person.
Absolutely, and that's how the platform is built, right? Even the patient side, that's exactly how the platform is built. If you need access to this person, care,
Mm-hmm.
this is the individuals, the culturally competent individual. You need to connect to your friends. Here it is. If you need a virtual assessment at your home to let you know, to empower you data about your health score, your BMI, any health
Yeah.
condition you're predisposed to, we have that for you. Now, if you need your medication, we've got that for you as well on the platform where you can order your medication. As we evolve with different phases of this technology as well, is where we're integrating non-emergency actually book non-emergency rides to and from your home to the hospital. Then we're integrating a friend of mine has a great technology as well, where they connect you to your favorite food truck, healthy foods, right, to be delivered to kind of have the gap in healthy foods delivered to your home. So that's how the platform has been built. That's the entire vision to say, okay, now you have the platform that does it all, but then we have partners that we coordinate that care. So
Wow.
that's the entire vision here.
Wow. That is something that's really innovative in that those communities that normally would not have access to proper food. And again, that's a barrier. Like if there's not a grocery store in sight for at least 3 miles, and maybe, it's in um, a tough part of town where the transit system is not operating after a certain hour, and or you have weather conditions, there's still other ways you can get access to it. I love the food truck idea. Now that you brought up the point of the app, I want to start talking about that with you. So can you walk us through, like, high level of what it would look like to be on the app? Say I'm a mom,
Mhm.
soon to be mom, and I want to. So is it an app solely for um, mothers who are pregnant, right?
So it can be used for other, right? But part of that solution for us is identifying those early signs of preeclampsia and other conditions,
Okay.
right? However, this technology can be used for anyone, especially we intend for it to be used for culturally competent access those clinicians. So it doesn't have to be if you're a woman, you can have access to it because it's around well-being. We want you to be well, so that
Yeah.
we can what we would do best is manage your health records and your wellness very well, so that you can go
Mhm.
actually live your life and then have the data behind that, right, to
Okay.
empower you. That's what we do well in connecting the dots for you. So
Okay.
we're a bit of Kaiser Permanente, but online
Yeah.
without
Okay.
without the network agnostic. So we're network agnostic. So if you have a different health plan, you have a different insurance, we still are there for you. It doesn't matter if you switch plans, right? So if you may switch to like to a Kaiser or another health plan, a
Mhm.
care first, right? We're still gonna be there no matter what. And this is in the case for employees and employers. If the employer decides to go with different health plan because of reduced premium, we'll be there with you. And one thing that helps as well in this case is retention strategy for the
Okay.
employer. It's lowering those costs over time for your employee health well-being, but at the same time, is also if your employee are well and happy, those women are taken care of,
Mhm.
they're gonna spread your message about how awesome this
Right.
company is. It's gonna make it very hard on that woman to leave your organization.
Yeah. Yeah. Okay. So the right now the app is primarily focused on new mothers or soon to be mothers, but it's open up or will be opening up to anyone who is looking for healthcare
Correct, correct.
um, to
So
move through the
anyone that's
system.
exactly anyone that's looking for a culturally competent healthcare,
Sorry, culturally confident. Yeah, which is really
cultural
key.
competent, culturally sensitive healthcare. So it doesn't have that healthcare provider that may be on the other screen providing the care they may not be, they're gonna be people that look like you, but they may want some may not be people that may not look like you. They may be Caucasian on the other side of the screen, but they understand their bias, right?
Right.
And they understand the gap in care delivery efforts that comes into Black women and Latinx women getting care and their family, right? They understand that gap. And part of it as well is let's take for example the moms here, right? When
Mhm.
they're feeding themselves, they're not only when they're eating something, they're not feeding only themselves, they're feeding
Right.
as well. So that's why nutrition comes into a very effective. Magnesium,
Okay.
magnesium is very important as well when you're stressed. And magnesium oftentimes is part of the cure with preeclampsia to be able to manage that stress, to have proper iron intake. So those are the things that we are teaching. It's about the well-being of the entire person. And we know that 80% of healthcare decisions are made by women, right? So
Right.
our point of focus is to go to the women and take care of them because we know in our communities that when mom says we're on a diet, everybody is going to go on a diet.
Oh my God. I had a flashback to my own childhood when my mom and her sisters would go on their diets together. Oh my God. And it was the 90s. So there was always some new diet popping up. And we were kids and we were like, dang it. Oh my God. No, but to your point, that's true. Okay, so the app is open, it's available. I heard you, my follow-up question was outside of who could use the app is how do you one find the talent, right? The healthcare talent. Do you go do your organization take them through that cultural competency sensitivity training, or do you partner with do you outsource that um, to someone else?
So we identify clinicians that are culturally competent, right? So
Like through assessment processing?
correct. So the and the, that,
Okay.
that and then the clinicians that we actually onboard are that. So these are clinicians that deliver care in those communities as well. So
Okay.
you're already used to those communities. So if you already know a clinician, a doctor, a wellness coach, a health coach, a nutritionist in your community already, and they haven't heard about the app, you can actually, as a patient, you can download the app and refer that clinician to be on. So you can actually put them on, right?
Oh, okay.
So
Oh, I love that.
you can put your clinician on and be like, hey doc, I know about this technology. I already have an established relationship with you. Let me put you on and let me refer you. And then they can the clinician actually can download their own side of the app. And then the patient will be able to connect with that clinician anytime, anywhere, right? It doesn't matter if they're at home, they're out of the country, because we do work out of the country as well in Caribbean countries and as well as African countries. So if you're traveling, it's there with you. That person is there to provide that readily available care whenever you need it.
That is actually something that I love is kind of going back to how a lot of communities shared information. I mean, to this day, we operate off that referral, that word of mouth type of system. And we've translated into the social media space. I mean, I get links all the time throughout the day, hundreds of texts or DMs referring me to someone that helped them with whether it was in finances or education, or it doesn't matter the genre, but to your point, word of mouth and is really key. So then how do is it a paid system? I heard you reference the insurance. So do you have to have insurance in order to um, utilize the app in its full capacity?
No, you
Or
do not. So we
okay.
take so for our community, we're aware that some people may have insurance, some may not. So you
Mhm.
can utilize the app without insurance. There for the provider, so we charge provider between 50 and 150 a month
Mhm.
to utilize their side of the app. So there's a healthcare providers, and then for
Mhm.
the patient side, it's $10 a month, or you can just pay when you want to see a clinician, right? So it's either $10 a month per month to see to get access to the virtual assessment. So you getting access to the clinicians. That's free. To do the virtual assessment, that's the $10 cost. But then anything otherwise is it's free to the patients. Um, Now on the employer side, so if you already have an insurance through your employer, then we can work with that employer
Okay.
as well, and that employer may actually pay and reimburse, pay for the service.
Mm,
It costs you zero. It costs the user, the employee, nothing. It will cost the employer $12, or wherever fee we decided to negotiate. Usually it's about between $10 and $12,
okay.
um, to utilize the technology for the employee to get access to our entire suite of solution.
Okay. That makes a whole lot of sense. So, as I'm thinking about this, I know telehealth is something that's imperative, especially after what we experienced with COVID in 2020. And as we're continuing through what that then will mean now and in the future, telehealth is really important. Um, for those that may be listening to this and they currently have access to some type of telehealth through their physician now, I hear you saying you can refer that physician to this app so they can also be listed on here to not only give service to their current patients, but open up to more patients.
Mm-hmm.
The other thing I hear you saying is that if you, again, you all listen up because I'm thinking about you all, I'm thinking about myself as well, but all of us have, if you have insurance, all of us have access to resources, but they're kind of all over the place. I know for me, I have a hotline I can call, but when I get on it, they then say, well, if you need this, talk to this person, you need, and I'm like, okay, but can I just talk to one person to get this one answer done? And what it sounds like with this app that Muhammad is sharing with us is that it's a one-stop shop, and to be able to get access to healthy food trucks in your area. I know we have them in our area, but also the potential to connect with other physicians because maybe there may be specialists that you're looking for. And it doesn't sound like you have to be in a certain network, which is always a benefit
Mm-hmm.
for us as well. So I see a lot of value, even if, again, I'm thinking about those who may be thinking, oh, well, I already have that access. No, this is definitely something you want to look at. Did you want to add to that as well?
Yeah, I mean, so for us, think of us as healthcare is highly disconnected.
Hmm.
And if you're already sick, you calling that hotline, you're already frustrated, like, bruh, why are you putting me on hold and connecting me to all these people? And at the end of the day, you don't give me the answer I want.
Right.
Let's take the headache off of you. That's why we built this with you in mind, by coordinating that care, saying you need to talk to someone. You've got that, right? Video or in-app message. But then if you are doing what you're supposed to be doing, your healthy routines, and you're going out with your friends and family, going on walks and hiking, we're gonna give you rewards for adopting those healthy behaviors, right? I was like,
Right.
oh shoot, you're gonna reward me for my for doing these things that I'm already supposed to be doing. Yes, because that's a change behavior. We want you to be your full healthy self, so you can perform whatever task you're performing. So if you're an entrepreneur, so you can be your best entrepreneurial mind, right? Because it is your mind and your body that really
That's true.
that's what you're being as an entrepreneur and as an athlete as well. So if you're an athlete, a mom that's an athlete, or you have your kids that are engaged in being athletes, it's your mind and your body that you need to take care of. And so we are ensuring that those pieces are connected, as opposed to the disconnected healthcare that's out there. If you want to, and for the older population, you want to manage your medication. And we know I'm young, but I tend to forget about if I'm put on the medication, how to manage that, like reminders. We got you. We give you reminders as well, like take your medication at this
Oh,
time, and then when to actually order your medication as well, have the medication delivered to your home. So that's what we do. We do that well. So all the platforms that are out there, they again, that's 10 platforms I just listed for you to be able to manage all of that.
Yo, listen, we're going to put the link down here for you all because I know anyone listening to this is going to be excited about going to the app, checking it out, signing up. Mohammed, as we are wrapping things up, what is the call to action for those that are listening to
So
you
a
guys today?
call to action. If you know somebody that knows somebody that knows somebody, your cousins, your aunties that are in the healthcare space that may not know of us, let them know. Tell them. Share it. Refer us. If you already have a dog, tell them that hey, there may be cultural conferences and they actually can earn money as well, right? So there's two apps. There's two products that we have: a patient and a provider app. Two separate apps, and those docs as well that refer their friends, they get rewards as well for doing those referrals too. So tell their doc friends, your nutritionist, your health, your personal trainers, and things of the people of that. Tell them that we're around. And if you want to check us out, please give us a try. Reach out to me. My contact is in contact us at InovCares.com. Um, so you can my direct plug, my direct email, and as well you can reach my CTO Love More Chirombo, L Chirombo. I know that's a little strong name, so
Okay, we'll put it down in the comment area as well. And we
yeah,
love strong names.
yeah. So yeah, actually, you can tell we're both really working on changing the narrative for people that look like us.
Yeah. And just to add on to that, if any of you all, in addition to checking in your family ecosystem or friend ecosystem, we also want you to look for any groups that are connected to clinics and coalitions that would allow Mohammed and his team to come in and speak with them. Because again, the work that he is looking to do is going to impact at the larger level, the micro level and the macro level. And so we definitely need access. They need access. So if you know anyone in the healthcare industry, like I said, whether it's clinics um, or coalitions, even policymakers, definitely reach out. Again, all the contact information will be below. You can find Mohammed on LinkedIn. You're going to find him on We the Plug as well. Let's see. Are you on Instagram?
And we're on IG. We're also we also launched last year a podcast called the Empowered Patient Podcast. So we're there as well. We've had 30 episodes. That's much more knowledge. And yeah, so there's various ways to reach us, and as well. So for Black founders as well, I'm here as a resource because I work with a couple of groups over here in Atlanta that support Black founders. So
that's right. And we didn't even talk about that, and we're at time now, but I definitely will make sure that information is put below. If you're in the Atlanta area, we definitely have some resources connected to Mohammed, so we will put that all in there. Mohammed, thank you so much for answering the call to do this purposeful work in the community, because you are changing and impacting lives at the grassroots level, and we know it's going to sustain us for generations to come. So we honor and thank you so much for all that you're doing for us and your families. And again, those of you all who are tuning in, definitely stay connected. Subscribe to the YouTube channel, We the Plug YouTube channel. You'll find a lot of content on there. Thank you so much for tuning in. You all have a great, safe rest of your day. Bye-bye.